right, so let me add you into here now.
Oh, actually, it is letting me go to a group, I believe. We'll see. We'll see. Oh, are you adding me? Or do I need
Yes.
To... Okay, perfect.
Yes.
Oh shoot, I might have to take off the sound on one so that it's not echoey. Is it super echoey for you, or are you doing okay?
Yeah, I need to, I think, let me mute 1 second.
Yeah.
Oh, no. I think I'm gonna have to mute my computer. Okay. So I'm gonna go to Instagram.
Okay, sounds good. Thanks for bearing with us, guys. We are just getting rolling here.
Thanks for hopping on, guys. We will be getting started in just a second. We're just getting everyone connected.
So you have it streaming through Instagram, right, Alissa? Sorry, what I mean is you have your sound coming through Instagram, right?
There we go. I can see you now.
Hey.
Hey.
Okay.
Hello.
Okay. I'm hoping that the sound is okay. Just let us know you guys how this sounds on your end. Because I've now muted my laptop and then I'm just listening through my phone. So hopefully this all works. So, oh my gosh. There's like so many things to consider when you're streaming on 2 platforms. So we're doing our best here. And let's see. I don't know if that's it. Let me see. Just give me 1 sec to get this Zoom going, and if I can't get it, we'll let that be for today. One sec. Okay, so this might work.
So are you unmuted on both of them then?
I'm unmuted on my Instagram and I'm muted on my Facebook. Do you think that's okay?
Are you guys able to hear us all right like that, or is it echoing? Hopefully everyone's good, unless anyone says otherwise.
Yeah, the other thing I could do is maybe put my AirPods in for Instagram, and then I'm just trying to think how this will work sound-wise. Anywho, okay, let's get going and then let us know, you guys. Oh, perfect. Thanks, Heather, for that.
Awesome, thank you.
All right, so thanks for joining us, you guys. We have been like dreaming up this class for quite some time. Both Alissa and I are busy in our own respects, and so we're grateful that we were able to kind of come together and like bring this class to life, because immediately when I saw, you know, what she was chatting about and her balanced approach to everything wellness, but specifically mental health, I was like I want to connect with you, and I also think more people need this information. So I'm going to do a quick introduction to who I am, and then we're going to move into a little bit of kind of content. She'll introduce who she is and kind of her background, and then we'll move into a little bit of content that we sort of have planned out that encompasses just supporting ourselves through a variety of different ways. We called it your mental health toolbox because that's what we feel this truly is. It's not a one size fits all. It's more of a take what works for you and leave the rest kind of an idea. So a little bit about me. I am going to be turning 30 in 2021, which is crazy to me. I live in Alberta, Canada with my husband. We have a almost 2-year-old. She'll be 2 in 2 weeks. and we're due with our second baby in 3 weeks. So you do the math, it's a little like crazy with the timing over here, but we're so grateful and really excited to meet our new little one. And I am a nurse by trade. I've been an RN for 7 years. And yeah, that's been a really big part of my life. It's been really foundational in my kind of approach to health. But I've done some, different things beyond that since becoming a nurse. I'm an aroma yoga instructor. I am a fitness instructor at a local studio here in Edmonton. And I am an advocate for moms and for mental health in general and all things kind of wellness. I really sort of dip my toes in all kinds of areas of wellness, as we'll kind of talk a little bit more about today. So when Alissa and I were chatting a little bit about like mental health and what's going on globally and like the importance of this topic, what came up was that like ultimately mental health, especially in Canada, and I don't assume the States are any different, was already problematic or a cause for concern prior to this global pandemic. Like in general, Canadians were not doing super, super good. So the pandemic has magnified and highlighted how crucial mental health services and support for mental health is in general. And a recent poll, so I found like some statistics sometimes help us like understand the gravity of things. So a recent poll found that 50% of Canadians reported worsening mental health since the pandemic began, not surprising, with many feeling worried, 44% feeling worried, 41% feeling anxious, and 1 in 10 Canadians polled said that their mental health had worsened a lot as a result of COVID-19. And then I also wanted to highlight like who is most affected by this, because there's a chance you fall in one of these categories or even multiple of these categories. Alissa and I, both being healthcare professionals, we are in one of those groups, which I'll mention. So a recent CAMH study, and we will post the links to the studies in the Facebook group that we're citing today. So if you're interested in knowing like where they get that information from, we'll post it all so you guys can reference it on Facebook. Found that women, people who have lost their jobs as a result of the pandemic, those who are worried about their personal finances, so financial stress, people with children at home, hello, and young people are more likely than others to experience symptoms of anxiety and depression at this time during this global situation. And then essential workers, so frontline workers, people whose jobs have been necessary throughout the COVID-19 pandemic, have also a greater degree of stress and a higher likelihood of developing anxiety and depression and other mental health disorders as a result of what we're going through. And again, that's on top of like their baseline, whether or not they were predisposed or they had an already diagnosed mental health condition. This is like above and beyond that. So it's definitely a cause for concern. And it's something that we, like I said, we really wanted to shed some light on and chat a little bit more about. So I'm gonna pass it over to Alissa. She's gonna give a little intro and then we'll get into some information.
Yeah, thank you so much, Jaimi. I am so excited to be getting to do this class with you and to have everyone here that's getting to partake in it. So a little bit about me. I just finished up my 3rd year of pharmacy school. I am currently getting my doctorate of pharmacy. And so it's a 4-year program. I actually just moved yesterday back to Northern Virginia, right outside of Washington, D.C. in the United States. And so I am about to embark on a full year of clinical rotations to get the hours towards my license. So big changes happening. And in this time of change, I think it's like more important than ever for me to focus on my mental health. And so it's really great to be able to chat with you guys while this is happening too. And especially with the fact that, with everything going on in the world, like you mentioned, Jaimi, mental health is a more important focus than ever before. But even as we move forward, going, hopefully out of COVID in the near future, hopefully, fingers crossed, regardless, there's always going to be things in life that are going to throw you for a loop, and you're going to want to have these tools accessible to you to be able to, handle whatever comes your way. So mental health has been something that has been a huge passion of mine for many years now. Um, since I was in high school, even. And so moving forward, when it eventually impacted me myself, which I'll share a little bit more about my story in a little bit, but it's just become increasingly more important to me over the years, and now, more important than ever. And so just to jump in, I know one of the reasons why probably a lot of you are here is you're curious about what the science is behind these essential oils and all these natural products and things that we so commonly advocate for when it comes to mental health. So I know we kind of bring a unique perspective because it's very challenging, quite frankly, to be able to understand the science behind these. But I think it's really important because it helps to validate why these products are really so essential as part of the picture of how you can improve your mental health. So I wanted to start out today with just kind of diving in. First, I'm going to start out with essential oils. This has been one of my biggest passions when it comes to natural products in general. To give you a quick little background on how I even got here, as a pharmacy student, everyone is always wondering, you're a pharmacy student, how is it that you became interested in all these non-pharm options? At the end of the day, all I want is to be able to treat my patients and help others and serve those who are in need. And so regardless of if that's through a pharmaceutical option or a non-pharm option, just want to know the most about whatever is going to truly work for my patients. And so, one of the areas that I found to be the most polarized was essential oils. That's one of my biggest focuses, is because I just wanted to be able to fully understand them for myself and be able to form my own opinions on them. So, essential oils. Also, I think probably most of you here are essential oils people, so I'm going to dive into the science of that. So, when we talk about an essential oil and why it could play a role in regulating our emotions and our mental health, it comes from this idea that we have in our nose, we have what's called the olfactory system. Our olfactory system is able to take up these molecules when you inhale an essential oil. It's able to take up the molecules, and it processes them through the limbic system in the brain. And so, in processing them through the limbic system is what regulates things like our emotions and our memories. And so, just right there, you can kind of see where this whole idea would come to be, that inhaling an oil would actually directly impact your emotion system in your brain. But one of the coolest things to me is this idea of memory as well. And so when we're talking about, for instance, if you think about the smell of your grandmother's house as she was baking cookies as a child, or something along those lines, something that is a really strong um, scent that's associated with a memory from your childhood. Well, now when you are an adult, say you were to smell something that smells like your grandmother's cookies again, a lot of times what you'll notice is immediately it'll elicit this really positive, happy response.
Mhm.
Um, and a lot of times it is very similar with essential oils, even. And so, if you have a positive emotion associated with an oil, for instance, like for me, frankincense is like totally my oil. Like I immediately always have a really positive memories associated and positive emotions associated with inhaling frankincense. So, this is all processing through the limbic system of your brain. And that's why this whole idea of scent and emotions and memory all really truly do go hand in hand. And so
Mhm.
when people, talk about, is there really a validity behind essential oils? There really is. Like, there's genuine science as to why this would make sense. And it's why I am such an advocate for people really doing their own research into that. And so, Jaimi, do you want me to jump in now to kind of explaining exactly how we then bring the pharmaceuticals into that as well?
Yeah, I think that's great.
Okay, and if anyone has any questions at any point in time, oh, I'm seeing so many of you jump on. Thank you all for being here. This is seriously making my heart so happy to see you all. So if you have any questions, throw them into the chat. Once again, this is like a very complicated topic. Like this is not something that is even like always super intuitive to me. I have to brush up on things all the time too. So ask questions. I'm happy to answer them. Um, but one of the things I wanted to dive into a little bit is I've talked about this topic before of lavender and its relation to pharmaceuticals that we specifically use for mental health. One of the biggest classes of drugs that are used for things like anxiety and depressions are this class of medications called SSRIs. It stands for selective serotonin reuptake inhibitors. It's really targeting the serotonin in our body and allowing us to make sure that we have enough of it to help improve those different mental health states. And so, kind of interesting, a little bit of a backstory into how I came to look at the comparisons behind SSRIs and oils like lavender was actually in my psychiatry module in school. And I decided, I kind of wanted to just see like how, if I could kind of understand all the mechanism of action of why something like lavender oil would play a role in regulating emotions and our mental state in general, and if it was any relation that I could compare and contrast with a pharmaceutical. And so in having that background knowledge of already understanding how something like an SSRI worked, then when I started digging into looking at what the proposed mechanism of action was for lavender, and I'm talking about like in scientific studies, this is what the hypothesized mechanism is. I started to notice, I was like, wait, this is exactly what SSRIs do. This is the exact mechanism that I already know is how that they work. And I was honestly shocked. I never would have thought that they work the same way. And so let me try to explain it in the most basic of terms for anyone who's interested. And I'm sorry, I hope I haven't lost you guys in terms of your interest level yet. I know I can kind of get into like the sciencey nerd mode there, but basically
Here
when we
for
talk
it.
about thank you. Got one person on my side.
Yeah.
I appreciate it. So when we talk about SSRIs, the way that they work is we want to have basically the most amount of accessible serotonin possible when we're trying to target serotonin to be able to target things like anxiety and depression. We want the most amount accessible in the body. And so the way that it works is the serotonin is released from these presynaptic neurons, we call them. And then you have a presynaptic neuron here, you have a postsynaptic neuron here, and in the middle you have this area called the synapse. And when the serotonin gets released from these presynaptic neurons, this is kind of like the golden space here, right in the middle. That's where we want it to stay. But what happens is the neurotransmitters are either sent to the postsynaptic neuron to be degraded, or they're sent back up into the presynaptic neuron and basically taken back up into them. So it's no longer in that golden space. And so basically once again, the SSRIs, they stand for selective serotonin reuptake inhibitors. So they're inhibiting that reuptake. And that is really similar to how it's proposed that lavender works. How crazy is that? I mean, it absolutely just blows my mind. Basically, they're saying that it's also inhibiting the reuptake of serotonin so that it can stay in this golden space. So that's just a little bit of the science of kind of how it actually makes sense that a lot of these things really would work in our body. And there's actually some evidence to support that this is truly what it is doing. So let's see. I think that there may have been one question. Oh, can you please be my pharmacist?
I love that.
Sure, I'll be your pharmacist.
And I agree.
Oh, I love this. Thank you.
I agree. I love Alyssa's, like I say, I call it a very balanced approach. It's kind of looking at things from all sides. And her and I were chatting about this. And like, there are times in people's lives. I was listening to a podcast the other day that I love by Happy as a Mother. She's a psychologist, and I think she was interviewing a probably a psychiatrist, and they were talking about how appropriate certain medications can be, especially in postpartum periods, which is obviously something that I've dealt with recently and I will be dealing with again, is being in that postpartum period where hormones and all kinds of different things are changing in the body and in the brain. And she was talking about how night and day certain medications can be, especially at certain times in our lives where we're really just lacking, or we're struggling for a certain reason, and there's a chemical change that our body requires to feel better. And so Alissa and I, we've seen this, right? We've seen this in her schooling and in my practice as a nurse. Like, I've seen the positive benefits of being on the right medication. So we're advocates for that, for sure, right? But there's also this other side where, like, bergamot, I know, is another or another essential oil that has been shown to work like almost exactly, or as effective as a benzo in certain cases. And like, these are things that you can start to just Google. Like, you can just say like bergamot for anxiety, and you'll start to see some scientific like peer-reviewed articles. We're getting more research, like it's coming. But it's very much like super interesting, right? And I did say in one of my Instagram stories today that like so many medications are based on plants that we find in nature, right? And Alissa would know way more about that than I would. But like, that's important for us to acknowledge, because again, it helps to support the validity in what you're feeling when you take an oil and you inhale it, right? You're like, I noticed something. I noticed a shift, right? I feel different. My body feels lighter, or I feel sort of some relief wash over. Even more so, I find when I diffuse my oils or when I wear them topically, that relief or that sensation stays with me for longer. So thank you, Alissa, obviously, for that amazing like description of what's happening. It takes me back to nursing school, and I'm like you, like, we can't know everything. I have to look up, I have to like brush up, that was your wording, on certain things too, because we can't all know everything about everything. And it's so nice to just have that sort of breakdown of how things work in the body, and I appreciate that. So should we talk about a few oils? What are your favorite essential oils that you like love to use?
Yeah. So, okay. So frankincense always will have my heart, kind of like I mentioned before. It's my all-time favorite. But I think that so things like frankincense, stress away, some of release, that was the one I was just smelling just now. This is probably like one of my newest, like, big favorites for especially emotional support. Those are some of my favorites that I like to use. But I think you bring up, just in saying like which one are my favorite versus your favorites, like, I
Yeah.
think you bring up a really interesting point, because I'm looking at the comments that people are leaving also, and we all have these different favorite oils, right, that work for things specifically like stress and anxiety and mental health and all of these things. And guys, one of the coolest things that someone mentioned was about Northern Lights Black Spruce.
Mhm.
Just a thought, with something like Northern Lights Black Spruce, one of the reasons why people are so drawn to things like woodsy oils a lot of times for emotional support is because if you are someone who really resonates, like, you get a lot of positivity from being in nature. Remember how we were just talking about the limbic system and how your memory is associated with your emotions? It all goes back to that. When you're inhaling those woodsy scents, it's bringing you back to a place of when you had happiness out in nature, and now it's eliciting all these positive emotions. And that is why each of us benefit from different oils in such a different way. And so for me,
Yeah.
once again, things like release, frankincense, those are some of my favorites. I have a roller, probably my all-time favorite is a roller altogether of frankincense, stress away, valor, and citrus fresh. I love that combination more than anything else. It's my favorite. But yeah, I'm curious to hear, what are some of your favorites as well?
Oh, I am I love a variety. I really do. And the longer I've been using oils, the more I've kind of been opened up to like, this one is so amazing for this, and this one is so amazing for this. Frankincense, like you said, very, very grounding, I think of it like the
Mhm.
roots of a tree, like digging deep into the earth. Love it, love to use it in my skincare. So it's very much for me a therapeutic oil where I'm applying it with intention. It's in my glow serum. I feel really amazing as I do it, and it sort of is just my time to kind of reflect on my day when I use it at night. Lemon, I don't have the research in front of me, but I know there's some cool stuff with D-limonene. I don't know a ton about it, but this oil and the different components of it are like pretty famous and very supportive of uplifting your emotions, and for me it's a very bright and also just like a very affordable oil. I've used lemon from other
Mhm.
brands and did not have the same noticeable effect in my kind of demeanor, but Young Living's oil, holy cannoli, like I have it diffusing in my kitchen upstairs. It just totally puts some pep in my step. Black spruce, it's a Canadian oil, so we love it so much here in Alberta. We're so lucky to have like just good accessibility to black spruce, and of course, it reminds us, like you said, of our nature and our connection to trees and all of the beautiful plants that surround us. So tree oils, big grounding and support for me. I can put on a tree oil and feel like I can do anything. Valor is another one. I keep a roller in my car and I often roll it on when I'm driving, and I just find it helps me to sort of stack my joints properly and find my correct posture and just I don't know, support my outlook, and I just feel really good when I'm wearing my Valor. The last one I'll share is called Inner Child. You've probably used
Mm.
that oil. The smell to me is like nothing I've ever smelled before. I could wear it like essentially I wear it as a perfume because I just really love the aroma. I know there's a ton of different benefits because of the different oils that are in there and how they're kind of mixed so synergistically to create this blend. Oops. Uh, Sorry, I have, hopefully it loads again. Sorry, Alyssa, one sec.
I can still hear you. Your face is still loading, but I can still hear you at least.
Sorry. I think my Instagram froze for a sec. Just give me a sec.
Oh, 1 second.
Oh, am I back? I'm back. Can you see me and hear me? Okay.
Oh, I think you're back now. Yeah, I think you're good.
Okay. I'm gonna keep talking. Sorry, this is something I don't know if we'll get there today, but I have screen time restrictions on all my apps. So my Facebook and my Instagram, I can only be on for a certain
Oh.
amount of time. And of course, that came up while we're doing this class today. It's like, your screen time's done. Anyways, that's in my mental health toolkit. I kid you not, it's a huge support for me. It's just making sure that I am not on social media
Yeah.
every single day. So anywho, inner child, and yeah, anyways, the oils in there are very supportive, and I love it so much. So I love all the oils, but there are some specific ones that I definitely go through seasons with where I use a ton. Joy is another one too. I love to apply it on my heart.
Mm.
Postpartum moms, I often suggest joy as like, let's get you some joy. We do Endoflex too for kind of overall hormonal support, but joy is my big one for emotions, because as you're riding those waves of hormones in the days postpartum, I found it really supportive of those emotions, and just allowing me to honestly get through the day. So that's a big recommendation of mine. So yeah.
Well, it's so funny. I don't. Oh, sorry. Go ahead.
No, you go ahead. Was there anything else you wanted to speak to on? Oh, well, we talked about a bunch of different. I have my starter kit right here. Like, this is honestly, obviously, something we recommend quite readily to people who are like, I'm new to oils, like I don't really know where to start. I think 3 or 4 of the oils I mentioned are in here. And I know you guys' starter kit is just slightly different, but it's always nice to get that sort of array of essential oils, so you can sort of experience the range of them. So yeah, I just wanted to mention that that's where I'm kind of grabbing most of my oils from over here.
Well, I was just going to say, it's so funny that you mentioned about joy, because I don't know if you have access to the questions box also, but someone else just asked about joy actually,
Oh, cool.
and was wondering if we could talk about how some people love it and some people hate it. And it's totally just dependent on the person. And I actually have a really cool story that kind of, I think, does a good job of explaining why this is that some people love it like you do, and then other people are not such a big fan.
Sure.
And so I think so my theory on why this is that it really goes back to this whole association with memory. If you have a negative emotion associated, or a negative memory somehow associated with something that is remotely, smells like joy, something that reminds you of joy, or any oil in general, if it's a negative emotion, it's probably going to cause you to, when you smell that, to have a negative emotion
Mhm.
associated with it. I actually was just a guest on a podcast recently that's airing later this summer, that and the host, she's absolutely wonderful. Her name's Katie Axelson, and she was talking about how she used to use lavender a lot when she was traveling. She would be packing, I believe she was overseas at the time, and she now has a actually negative emotion associated with lavender, because she has this whole memory associated with lavender and the stress of packing. And lavender, that's, is normally known to be a oil that really helps people with de-stressing, and now it has the opposite emotion for her because of that memory association. So my assumption is that probably with something like joy, or really any other oil where some people love it and some people hate it, I think it's probably along those same lines. And like you were mentioning, Jaimi, like with the starter kit, that is why anytime anyone's asking me about oils for mental health, I just immediately recommend the starter kit, because the thing is, you just never know what exactly is going to work for you. And when you get something that's a starter kit that's like 12 oils that, I mean, half in that thing are designed to, like, immediately just for mental health.
Yes.
And so you can kind of try different things and figure out what specifically works for you, rather than, buying them individually and risking maybe not having a positive association with them.
Alissa, I honestly feel like it might be beneficial for us to do another class where we specifically talk about that, because a few things are coming to mind, including the fact that essential oils work even if we can't connect the smell. Like if we can't smell, I don't know if you've met people who can't
Yes,
smell,
yes.
and obviously we're seeing that as a common symptom of the current virus circulating. I have some friends going through it right now. And yet I'm like, keep
Yep.
using your oils, keep using your oils. There's olfactory training that you can do. But I also know people who were born without a sense of smell, and they still use essential oils even though they can't smell them. So maybe we'll have to, I
Mhm.
feel like that's maybe a topic for another day, but you bring up a really good point. I have a friend whose husband had, I think, a traumatic dental surgery where they used clove, as a pain reliever on the gum or whatever. And forevermore, he's been unable to tolerate thieves, which is like so sad.
Oh,
But
oh
like,
no.
and I mean, that's a pretty like visceral, like he's like, I remember I was in pain and the clove smell, like those two things are forever interconnected for him. But I think you're exactly right with joy. Often for people, there's like, joy is quite floral. So there's some geranium in there, some other floral oils, rose oil, and those can sometimes be a little bit off-putting to certain people. And even if you don't consciously know why you don't like an oil, it's so interesting that your body remembers, right? So
Yeah.
trust your body, right? If you really want to use a certain oil and you don't like the smell, I always tell people to put it on the soles of their feet and put their socks on and
Mm.
allow their body to sort of get used to it. And or I'll with an oil like Joy, I'll say like put 3 drops of Joy in the diffuser and 3 drops of orange or lemon or citrus fresh, something else that's going to sort of dilute the smell of Joy, but also allow their system to get used to those different odor molecules, I guess it would be, right? So that's an option too.
Yeah.
If you're like, I really want to use this oil, but I don't know why I hate it, like I just can't tolerate it, whatever. I would encourage you to use it in a way that is less bothersome. You don't have to wear it like perfume if you don't love it.
Exactly. Yeah, absolutely.
So just something to keep in mind. Okay, we're gonna keep rolling because we do have some additional content we want to get to today, but I'm really loving the conversation
Mhm.
that's happening here. Alyssa's gonna save this video too for after, so we'll be posting it in our Facebook groups and then also as an IGTV, so for your reference in the future. And I think the response is so positive that we're gonna have to plan another class. Like I said, we can speak to the whole kind of sense of smell, olfactory training potentially in the future. So I did want to talk a little bit about, another tool that I referenced initially. And like, this is not like groundbreaking evidence. Like this is something you could literally put in Google and find like 15 articles right off the bat for. But it's important for us to recognize how important our physical health, so how much movement is an important clinical target to sustain and improve our mental health. So there's tons of benefits. Again, we can go into all of that, but to just kind of be mindful of our time. It's something that I use regularly. I want to say daily, but I'm that pregnant that it doesn't always happen daily. And it's a huge support to me. I used to work out for different reasons. I used to move my body for different reasons, and I've gotten to this place in my life where for me it is more mental and more supportive of my overall just like outlook, demeanor, everything than anything. It's more about the mental benefits for me now. And so that's definitely something we want to encourage people to be looking at. Not only in the healthcare world is it something that we want our patients to be doing. We want them to be moving their bodies as best they can to the level that they can, I suppose. But it's something that I do, like I said, almost daily. And when I'm not pregnant, it's definitely more of a priority for sure, because of the benefits that are proven time and time again, for both mental and then of course physical health, which are kind of like, it's like a feedback loop. Like they're very
Yeah.
interconnected in many ways, right? So we wanted to speak to that. And like I said, I teach aroma yoga. I also teach some different movement classes, row, cycle, and then more hip-based classes. And I said to Alissa, I'm not going to make people get up and like do exercise with me on this call, but I would like to teach them a tool that they can take with them and pull on whenever they need it. Okay. So I'm going to do that with you guys now. It's something called box breathing, and is actually used in the Navy by Navy SEALs to support their nervous system, to get them into the parasympathetic nervous system, where your kind of rest and digest functions of the body are controlled. It's to bring them out of that fight or flight and into that kind of rest and digest part of the body. And you can also heighten this breath by using an essential oil as you do it. So that's optional. Just know if you don't have an oil, you can totally still complete this breath. But it's something that I use regularly if I notice myself getting a little bit sort of ahead of myself. Maybe I'm thinking and stressing about something that's happening next week, or maybe I have a task at hand that I really just need to be present and just aware for. I'll pull on this breath. Actually, right now is not a bad time. I'm like kind of talking a mile a minute. So let's take a second and let's do this breath. I'm going to grab a drop of essential oil. If you have one, that's great. If you don't, that's totally okay too. So you can just drop your shoulders, sort of create some space between your ears and the top of your shoulders. Just notice how you are seated in your chair. Often I was kind of like this at the screen, so often we can bring the torso back over the hips, sort of looking for that alignment in a seated position. You can notice your core. Is it really tight, or are you completely relaxed through your abdomen? You can just take one deep breath and just let everything kind of relax. So inhale and exhale, just let everything go. And give the hands a little shake. Sometimes we just like have to get that energy out some way. So I'm gonna grab my oil and then I'm gonna move it around. Take a deep inhale, just cupping my oil over my nose without touching my face. You just wanna be mindful when you're using your essential oils of your eyes. And exhale, drop your hands to your lap. So this breath is very straightforward. You can actually extend it beyond the time frames that I'm going to give you, or you can just stick with it. We're going to work with 4 seconds for the purposes of today. So it's a 4-second inhale, a 4-second hold, a 4-second exhale, and then a 4-second hold. And so it's called box breathing because if you think of the sides of a box, it's going to be even, just like the sides of a box, okay? So if you can close your eyes and imagine the box, or you can keep your eyes open, however you're most comfortable is totally fine. And on the inhale, I am going to take my hands up to my nose and inhale my oil throughout this. So we'll do maybe just like a minute of this. Within 3 to 4 minutes, usually there's like marked differences noticed in the body. And like, again, a lot of this is really backed with research. So box breathing is something that has been proven to work. Obviously, it's a technique that the Navy SEALs use. So, okay, let's start with that inhale, 4 seconds. So inhale, 2, 3, 4, and hold, 2, 3, 4. Exhale through your nose and hold, 2, 3, 4. Starting again with the inhale, 2, 3, 4, hold, 2, 3, 4. Exhale, 2, 3, 4, hold, 2, 3, 4. Again, inhale, 2, 3, 4, hold, 2, 3, 4. Exhale, 2, 3, 4, hold, 2, 3, 4. One last time. Inhale, 2, 3, 4, hold, 2, 3, 4, and exhale, 2, 3, 4, hold, 2, 3, 4. So just notice how your body feels. Notice any shifts at all. Something I said when we were just getting started with the breath is in through the nose. It's really important that when you're doing intentional breathing, you do go in and out through the nose. It will activate your vagal nerve, which again is a part of that parasympathetic nervous system that's going to kind of calm the body. So just be mindful of that. If you're breathing through your mouth, if that's kind of your natural state, switching your inhale and exhale to through the nose can be really, especially your inhale, but if you can do both, that's great too. So I just wanted to share that with you. Again, you can pull on it anytime in traffic. When you're trying to get your baby to sleep, you can pull on it first thing in the morning to set the tone for your day. And yeah, it really enhances the effect of the breath when you use an oil with it as well. So, oh, Heather, that's so beautiful. Feeling closer to regulated. She says, I love that. All right. So how are you feeling, Alissa?
Oh man, you already know I'm such a huge fan of breathing exercises. Yeah. Like that was amazing. I feel totally like zenned out right now. Good. It's great.
That's awesome.
I personally genuinely feel like breathing exercises, or at least in my own life, breathing exercises and essential oils are the fastest things that work for me when I'm just in those like episodes of just not being in a good place, whether it's anxiety or stress or anything along those lines. I just think it really, I almost feel like I just immediately feel my breathing slow and my heart rate slow. Like I just feel like it takes me down so fast. And same with essential oils too. It's just amazing. You would never think something so simple would work so well. And one of the other things that I always like to point out to people about the breathing exercises, especially, is it's so great that you can do this anywhere. You don't have to have, a bottle sitting next to you. You don't have to go somewhere for a 30-minute exercise or something like this. All these other tools that are such a great part of the picture, but specifically breathing exercises are the fastest thing that you can do, and it's so accessible no matter where you are. Like you were saying, like even if I'm just in the car, like if I'm in the car, I can do breathing. If I'm sitting in traffic and I'm stressed, I can do a quick breathing exercise. I'm about to go out onto my clinical rotations, like I was talking about at the beginning. And those are like, there's a lot of stress for me surrounding that specifically. And so I'm so grateful that I now have this tool that I am able to use and have such great access to no matter where I am.
Yeah.
So I'm a huge fan of breathing exercises. Thank you so much for teaching us all that.
Of course. I'm happy to share. And it's free, right? There's no barrier to entry.
Yes. No barriers.
I love it. That's awesome. Great. All right. I guess I'll pass it over to you if you want to keep moving through.
Yeah. So I think one of the things that we've had a lot of time touching on today was especially like what to do when you're already in those places where you're feeling stressed, where you're feeling anxiety, where you're feeling like you just need support in general with your mental health right then and there. I think we've done a good job of like touching on that. Hopefully you guys feel like you have some good tools to be able to take with you. And also I wanted to touch on the fact, like putting the oil in your hand and just inhaling it. I think that's such a great way to really quickly get it into your olfactory system. So thank you so much for touching on that as well. And one of the other things though that I wanted to chat about, we're talking about all things non-farm here today. And so it goes past just, the essential oils and the breathing exercises. I think it's important to talk about what we can do to prevent ourselves from getting into a place where our mental health is at risk. And so some of the other strategies that I always really want to point out to people is I know both of us have definitely a connection with therapy. That is such an important one. I think that it's ridiculous that there's still a stigma behind it. I think it should be like going for a regular checkup. Sometimes you just need a second to have someone help you work through your mental health. Personally, like even I've been in a fairly good place with my mental health recently, but I am getting back into therapy just because I don't want to get into a place where I feel like I'm having to use all of these tools that I need in the moment again. Like I want to be able to focus on prevention and making sure that I'm maintaining a positive mental health space. And so things like therapy, yoga, meditation, even, if you're spiritual prayer, though I think those are all really essential parts of the puzzle also that I think maybe sometimes there isn't enough attention put around, because a lot of times people don't want to really focus in on mental health until they're directly in the depths of trying to combat it. So I just wanted to point that out. Another big thing I like to do is journal. That's another one that I just find to be really beneficial, is to get all your thoughts on paper. And the last one that I was thinking that I wanted to chat about, in case anyone was interested in it, because I know it's kind of a hot topic, was the idea of using CBD. But is there anything else that you want to talk about in terms of like prevention or like acute management or anything like that first?
Yeah, like I'm so glad you brought up the therapy piece, journaling. I completely agree. Meditation, those grounding exercises that we can do to stay, like I think that that's like maintenance. You know what I mean? That's like drinking water and like and yeah. So very very good point that a lot of what contributes to overall mental wellness is this stuff we do on the daily. And it's the micro things that really can make such a difference. I just wanted to really quickly mention, like, yeah, the therapy piece for me. I had never seen a psychologist until I think it was earlier this fall. And I remember sitting in a group of friends. We were socially distanced at some sort of a gathering. And basically, all of them individually said, yeah, I've seen a therapist. Yeah, I've seen a therapist. Yeah, I've seen a therapist, like, at various points in their lives. And I was sitting there, like, I've had, coaches and mentors and different supports in my life, but I had never actually gone to a psychologist. And that really, like, encouraged me. I was like, oh my gosh, like, I don't have to be like ready to check into the hospital to like seek some support for what I'm feeling. And so I started to see my psychologist, like I said, in the fall. And initially I saw her a little bit more regularly. I needed a little bit more kind of support initially, really struggling postpartum and in a pandemic situation. But over time, I've been able to, and not that this is like a badge of honor or anything, it's just my personal experience, but like I've been able to space those visits out where it's usually every 2 to 3 months where I see her. And we call it like my mental health tune up. Like it's like a check in, right? And she'll validate my
Yeah.
emotions. She'll ask me, what are you thinking about this? The last time I saw her about a month ago, she said, how are you feeling about baby coming? Do you have the right supports in place? What are some areas you think you might want to be working on leading up to the birth of this baby? And I felt so supported in that moment. I felt like I had someone in my corner. And we've got one booked for after baby comes. So anywho, my personal experience has been that has been like a ginormous support that I didn't really understand how it could support me beyond what I was already kind of accessing. Friends and family are fabulous, and often they are incredibly supportive. I talk a lot about this on my Instagram too. But oftentimes, when the people in our lives are maxed out, maybe they're dealing with their own stuff
Mhm.
or their needs aren't being met in certain areas, it can sometimes be so needed to go kind of to that professional support for your mental wellness. And I think that experiencing that firsthand has allowed me to sort of encourage the people in my life where I'm seeing things, like I'm seeing sort of some similar
Yeah.
triggers. I'm like, this is a real kind of like tricky point for you. Maybe it might be helpful to talk to someone about that, right? Like I'm happy to listen, but
Yeah.
you might actually find more benefit if you were chatting with somebody with a professional designation or whatever. So anyways, I want to share that. Thank you for doing such a great job of highlighting all of the different options. And I'm sure there's some that we're not even talking about that people are like, yeah, this is for my mental health. And we get that too. So yes, please speak to CBD. I would love to hear your perspective on that. It's not something I'm super familiar with or have used at all, actually, I think. But yeah, I would love to hear.
Yeah, the one last thing, first of all, thank you so much for sharing about like your experience with therapy. I think it's just so healthy for us to be able to openly talk about it. I am such a big believer in therapy. I've seen the difference it's made in my own life as well as other people's lives. And so I am just such a huge fan and support everyone going to therapy. The one last thing that I will say on it is just going back to like my nerdy science brain, like relating it back to pharmaceuticals, is one of the ways that I kind of like to think about it is um, if we talk about something like asthma, like if you're someone who suffers from
Mhm.
asthma or someone who suffers from asthma, there are times when you need a maintenance inhaler and times when you need a rescue inhaler. And
Yes.
that maintenance inhaler is something that you're taking on a regular basis to prevent having asthma attacks. Your rescue inhaler is what you need in the moment when you're having an exacerbation and you need immediate help. And I kind of like to think of things like therapy and meditation and yoga as kind of that maintenance inhaler,
Mhm.
whereas things like essential oils and breathing exercises are like that rescue inhaler. And they all just fit together into like this beautiful puzzle of kind of tricks and tools that we can have at our disposal. So I think both pieces of the puzzle are just so important. So
Yes.
thank you so much for sharing about
Of
your
course.
story. So yeah, just real quick, I know CBD is a hot topic when it comes to, I mean, in general, it's a hot topic, but especially with mental health, I get questions about it pretty frequently. So I wanted to break it down real quick, dispel some of the common myths, and hopefully give you guys just a better perspective on like what it is and what it means. So First of all, so CBD is something I got introduced to before I even started like getting into the research behind natural products. It was something that I had to do for a assignment that I had on one of my clinical rotations, and so I learned very quickly that there is a lot of evidence behind using CBD. I know so CBD right now is currently it is legal in the United States, but I know in Canada it is not yet. Correct?
I believe it's prescription based. Like we have lots of
Prescription
different
based.
clinics here, but it's tricky. We can't like order it from the US because it can't come over the border. Or I don't know everything, but that's sort of
Yeah.
my understanding.
Okay, yeah, yeah. So I think it takes time because of this whole because a lot of the understandings that there are behind CBD. I can understand why it takes time for, the legality process to
Yeah,
kind of play out. It is legal in the United States, and it's pretty like it's very accessible.
right.
And so I wanted to kind of explain what these common myths are behind it. So basically, the biggest issue for people is whether or not it can basically elicit this high that you get from something like marijuana, for instance. People commonly associate them together because they both come from a cannabis plant. However, the misunderstanding comes in that cannabis itself is not a plant, it's a family of plants.
Okay.
And so you have kind of like cannabis at the top. You have hemp is one of the plants that's in the cannabis family, and then what people commonly know as like marijuana, that is a different plant within the cannabis family.
Hmm.
So when you're talking about like the illicit drug marijuana, you're talking about getting the psychoactive component THC into your system. That is what elicits that high
Hmm.
feeling. And so that comes directly from that plant. Whereas on the other side of things, when you're talking about the hemp plant, you're talking about cannabidiol oil. And so hemp itself uh, contains, well, when we talk about CBD specifically, the oil legally has to contain less than 0.3% THC, basically saying it is not possible to get a high off of CBD.
Right.
And in fact, it doesn't even come from the same plant that the illicit drug comes
Okay.
from. And so that's kind of like a myth that I like to very quickly dispel so that people don't think that, this is something where people are using it for inappropriate purposes. Um, so CBD is something that has commonly been researched. It's been pretty extensively researched actually for use in things like anxiety with pretty positive outcomes. And so personally, I don't use it all that extensively for my own anxiety, but because it has been shown to have such strong scientific evidence behind it, I do always like to just kind of explain it to people and have people know that that is another option,
Hmm.
just another thing in the toolkit if you
Yeah.
want to have another option to try out.
Yeah, I'm super curious about it, and hopefully, Heather was saying, yeah. So we have like I guess consults that you can have done, and it can be, I think, sort of like prescribed here. I don't know exactly how it all works,
Mhm.
but it's something that, yeah, like the endocannabinoid system in the body is so interesting to me. And it's definitely like a huge, I've had patients who take it for pain, and different things related to, especially in the end of life realm. I've seen it quite a bit
Mhm.
more. um, but yeah, it's a good option, and again, something that works for, a lot of people might not work the same for you or I necessarily, but it's always helpful to have more options, more tools in our toolkit that we can pull on at different points in our lives. So thank you for shedding some light on that. I appreciate that. And
Yeah,
it's
absolutely.
definitely like a hot topic, like you said. So I appreciate that. Okay, so I think that that's kind of how we're gonna wrap today. Alissa, I've really enjoyed this, and I hope you have too. So we'll connect
Yeah,
after, maybe to
this will
see
be
if
great.
we can do like a part two, again, more specific to like our sense of smell and olfactory training potentially. The one thing that Alyssa and I wanted to mention is we do have a giveaway. We talked about lavender quite a bit today, and we're going to give away a lavender essential oil and a what do you call it? Like
A
a
diffuser
aroma
bracelet.
diffuser
A
bracelet. Thank
diffuser
you.
bracelet, yeah.
Yeah, so a way that you can keep your oils on yourself, and inhale the aromas and get the benefits of them throughout the day. So we're going to give away those two things. And the way that we're going to track this is if you guys follow both of us on Instagram, then we will enter you into the draw. So we'll be doing that shortly, and we will announce, post, and then message the winner for sure to get in connection, so that we can send you your goodies. Yeah, and feel free to message us both on Instagram if there's something that you would like to hear in a future chat of ours, or something you want some clarification on. We're both we're here for it. We're here to support the people who are seeking this information, and really it's been a lot of fun for us to pull it together. Oops. Okay.
Oh,
that's
Jaimi,
okay.
it just sorry,
Okay.
the IG ended.
Okay, that's okay.
But
are you able to save it, Alissa?
yes, let me just make sure, because I'm just gonna share it to IGTV, right?
Yeah, but I think you save it to your phone first, if I'm not mistaken. I'm just putting the Instagram handles in the chat for Michaela. Non-farm farm D, right?
Mm-hmm. Yeah.
And I'll put mine, and then we'll be doing that giveaway. Thanks, Michaela, for asking. And Cheryl, thanks for joining us. Hopefully the audio was all good on Zoom, guys. I'm really
thank you for sticking with us.
Yeah, and I've got a recording on Zoom, so I am hoping that all is well in that regard. And then I think it'll be up for like 24 hours on, I don't know how that works for your Instagram. I think, you can probably watch her the live on Alissa's Instagram for a little while, but hopefully she can save it and upload it to IGTV.
Yeah, I'm hoping that I'm going to be able to get it to work. It's showing me the share option. It's not showing me the save option, but I'm hoping once I share it, I'll be able to save it. So that's what I'm going to work on.
Sounds good. All right, you guys. Well, thank you for joining us. That was a little longer than we were intending, but I feel like the information was all so relevant and helpful. So I feel like it was worth it.
Yeah, thank you all so much for being here. We really appreciate it.
Have a beautiful rest of your Monday. Take care, guys.
Bye, everyone.